Vreni Schoenenberger. I'm the Global Head of External Affairs and Partnerships for Novartis Neuroscience. We're here today because the word of the day, and actually the word of the decade perhaps, is collaboration towards the future of brain health. Novartis Neuroscience is one of the core focus areas for Novartis as a company. We're one of the world's largest pharmaceutical companies, and we remain committed to improving the lives of people living with neurological conditions. We can't do that by ourselves, and we're here today to determine how best to partner with everyone else working in this space and people not working in that space that should be in order to achieve that goal. This has been a really amazing opportunity to have some honest conversations around the challenges that are facing, not only research and development, but policy making, some of the concerns that we hear around access to innovative treatments, but not just pessimism. What is reason for hope? Actually, really, I think agreement that we need to have concrete action. I think something that I haven't heard as much about as I might like to is some more around the World Health Organization's Global Action Plan, which was a landmark piece of policy that was passed last year and was built out directly in collaboration between industry, stakeholders, such as the patient community, the policy community. And this sort of, on paper is one of the first times we've seen a holistic approach to improving access and care for people living with neurological conditions across sort of a holistic, across the life cycle of a neurological condition. This is a holistic approach. But for now, even though we have some indicators that are written on, that are written down that we want to measure member states by, we haven't necessarily had the time or necessarily the attention to really focus on how do we take these numbers and turn them into actual local actions. So what I would really love to hear today or hear more about is sort of how organizations of all sizes, from not just the global perspective or the regional perspective, but really locally, how are we building out cross-sectoral responses to turn those numbers into actual action, and how are we measuring those on a regular basis? I think we'll start with, obviously in public health, we're at an understanding that nobody can do this by themselves. Public health is extremely complicated in terms of just, again, how we discover drugs, how we take them to market, how we have to address things like access. And again, this has got to be a multi-sectoral response. So since these are multifaceted problems, the solution to them has to, by nature, involve collaboration from various partners. I think at times we overuse this word without actually understanding that it can mean absolutely everything or absolutely nothing. Really what I would love to see more is a diversity of people who understand that brain health actually affects them. This affects everyone. When we look at neurological conditions, they have one of the highest impacts on quality of life of any disease area, and particularly from a global perspective, the burden of disease is massive. So collaboration can mean everything from properly listening to patient perspectives if you're a policymaker, to actually committing to work on access barriers if you're a large pharmaceutical company or even a small or medium-sized one. I think that really the question back to anyone who's working here now is, let's define collaboration in terms of action, not just in, sitting in a room is quite a good start, but what are we going to do about it and how are we going to measure that? When I think about where I hope these conversations are going to go, and again, I'm clearly big on action, these need to be part of the Sustainable Development Goals. We need to learn from what did and didn't work from the last time around we did this with the SDGs, and have actually more support for member states as they are trying to achieve these actual goals. This can be in terms of funding, this can be in terms of platforms, but I think we're finally at a point where we understand that the discussion about what constitutes brain health or mental health or even neurological health isn't necessarily the most salient conversation. The conversation is, how do we solve all of these things quickly and actively on the ground?